We started out in 2009 with this fledgling idea that we put to Arthritis Ireland as a charity. I suppose it's important to say that we don't recruit our own patients, and that was a very deliberate decision because we felt that there might be a bit of conflict there, and it's something that's turned out to be very beneficial, so we've recruited through charities. So we've built links with the charities, and therefore everybody makes a free choice to get involved in the process. I'm not leaning on my own patients to do something for me, so people have made a free choice, and they're very invested in it. Over those 6 years now, we've grown from quite a reasonably small and tight group. We've moved into now the Irish Society for Crohn's and Colitis have come and joined us, and we've a whole new invigorated bunch of patients come on board. We developed the Patient Educator programme because we saw both a need and an opportunity, and the need was the fact that students come in, they want to be doctors, they come in on a programme that they're going to, at the end of, they're going to be doctors, and they become involved in a very necessary and important part of the curriculum, which is a very science-based programme, but during which they feel slightly alienated from their real purpose. And they tell us that when we talk to them. They tell us that they somehow forget in the midst of exams and learning facts and doing very important science work that actually they don't get to meet patients and they kind of forget. We developed the programme to be able to put students in contact with real patients early in the curriculum at a time when they could see the relevance of their basic science learning to the patients that they would be treating.
Now, the students themselves have told us that there is no comparison to meeting the patient and learning the case history. That the experience of meeting the patient puts everything else just into perspective, because they have shown their enthusiasm and they have kind of appreciated it. They will always, the students in fairness, always show how much they appreciate us coming in. And we are only too delighted to come in and know that some way down the road they are going to meet somebody someday with arthritis, and something we have said might be the very thing that will help them in helping that person. You can learn your textbooks, you can do everything you want, but unless you're actually listening to the person in front of you, you're wasting your time.
I agreed to be part because I thought that it would help the students and maybe also help me, that I would learn something from it. I think it gives them a very clear picture of what the patient is going through. Regardless of what an illness may be, I think they get to see the impact it has on your life, how you struggle maybe each day, the positives also, that there is help. So I think it can be very, very beneficial to the students. It would be to listen to the patient, to listen to how they're saying a thing. Is there emotional involvement? Is there fatigue? Are they overcome by this? Or are they so used to it, it's just part of their everyday life?
One of the things that has struck me over the years is that it's had changed an awful lot, but still the voice of the patient wasn't really being heard at all. So it was great just to have the opportunity to come in and talk to future doctors. I found when I've met with students, I've been really, really surprised at how much they get out of it. They're always so enthusiastic, and I think it makes their training real for them, that instead of just being some academic stuff, that they're meeting real people, and we always get on real well, and you end up having a chat with them. And for me, it's great to see such enthusiastic people as well, so the students are great. 10 years ago, this would never have happened. And asking patients to get involved, it's a real sign that medicine is beginning to change, and that doctors are thinking about patients as people and patients having a say in their healthcare treatment. So they need people to get involved. It's a real benefit. And for me, it's been quite inspiring seeing the students and meeting doctors outside of the clinical setting, and you have a chance to actually chat to people, and you could see there's developments happening and developments going on. So it's been very helpful to me as well. And the most important skill that doctors can have is to actually listen to what patients are saying, and not just see them as a cardiac case or as a diabetes case, but that they're real people with real life stories, and you're a better doctor if you can understand that patient's story and where they're coming from. Yes, they want to be treated, but we know there's such a linkage between mental health and physical health. And if doctors aren't looking after the mental health of patients, how can they look after the physical health?
I got picked, and it was really, really good to be actually able to give something back as my own personal experience. Definitely a win-win situation for doctors and patients.
I agreed to take part in the Patient Educator programme because I felt that it would give me a chance to put all that I had been through with the Crohn's to good use, and also for the future benefit of patients like myself in the hospital setting and with whatever doctors that they met during their process of their illness. Benefits the students because they see the person behind the disease. That a lot of times when you have an illness, whether it's a gastroenterologist that deals with IBD or a cardiologist with the heart or whatever, they tend to focus on that specific part of the body. Whereas when you're a person who's dealing with various issues that encompass each of those disciplines, that it helps them to actually see you as a person that has maybe up to that point come through an awful lot. You know, for when they first meet you, it might be their first meeting, but you'll have already met a lot of doctors in the run up to that point, and you'll have been through a lot to get to that point. But if that they can stay on a friendly basis that makes you feel safe and secure, and that they'll look after you when you're at your worst.
I suppose it's a safer environment for them to feel more comfortable, to prepare themselves for when they actually do go to a hospital setting. So it's a great opportunity for them. They should look at the whole person, not just at the sore knee or the sore hip. That how, obviously they need to find a solution to that pain that they're experiencing, but how does it impact outside of that sore knee? Does it impact on their work life? Does it impact on their home life? And to maybe look at those aspects and to help improve that person's life.
So they need the skill of being able to talk to people, to develop therapeutic relationships with patients. And that's something that actually takes time. You don't just kind of turn it on and off, it takes time. So students need to be given opportunities where they can make mistakes, where nobody's going to be offended or hurt, or they're not going to cause problems if they make mistakes. As the students themselves said to me, they have to develop a style. So they develop a style, they need to learn to develop a style, how they are with patients. And having real patients who have huge experience of being out in the real world, being sick, coming to doctors, they have lots of experience with doctors. The students see them as really valuable guides. So what started out as we thought, oh yeah, the benefits of early patient contact, they're quite well described in the medical education literature, and you can read the list of things that apparently happen. But actually what we found through some of our research that we've done is that actually this stuff has emerged that we didn't really anticipate, or that we maybe weren't really aware of the impact of. So one of the big things that's emerged on both sides is this idea of identity. So the idea that the students have to develop their professional identity, and that meeting real patients really helps them with that, takes them away from just being 20, 21-year-olds to actually taking on a professional identity. And maybe what surprised me was how seriously they take it and how important it is to the students. And maybe one of the big surprising things, and maybe we should have anticipated it, is what I've described as reciprocity of empathy and communication between the patients and the students. So they develop this understanding of one another and the importance of each to the other that I didn't anticipate. So it didn't strike me that our patient educators would have such a vested interest in our students and where they are now in their course, and are they close to graduating, and have they just graduated, and where they're working. There's a real understanding and a real interest. And similarly on the other side, the students tell us that they'll never forget the patients that they met in the Patient Educator programme, that the impact that they have on them is so deep and so lasting that they'll never forget them. You know, young doctors who graduate, who've come across patient educators, meet them in clinics now And our patient educators come and tell us that, oh, I saw her as a second year student, and then she's the intern on the team looking after me. And those sorts of connections that I guess we should have been able to anticipate, but still kind of surprised. And now we're moving into a different area again, where we're starting to do educational research using our patient educators or with their help, where now we're looking at the role of the patient in education, and very specifically looking at what the patient brings that you can't get from anyone else, and specifically in terms of the role of actors versus the role of patients. Is it possible to assess their empathy, their care, their compassion, their interest in patients, and getting patients to do that, getting our patient educators to do that, and I think possibly, unbelievably, that's quite novel in medical education. So those are things that have been assessed either by pen and paper questionnaires or by a third party sitting observing an interaction who says, oh, you did very well, you were very empathetic. But people don't ask the patient how they found the student. So that's really very exciting, and that's something that's going to develop. We'll take that from very early stage students all the way through, I think, probably into the postgraduate realm.
Certainly since I started on the patient educator programme, the students that I've met have just been wonderful. So I'd like to send my compliments to them. They've all been very understanding, especially when I've been nervous starting my first sessions. And certainly any of them could be my doctor any day.